So generally, it's pretty standard now for a lung cancer patient to be asymptomatic. There's really nothing that's particularly bringing them to a family physician regarding a chest symptom or something regarding a concern of cancer. Often it is by accident. So for example, someone might have fallen down or had some injury, and then they happen to find a spot on the x-ray. Sometimes it's just by chance that we see something to do with a lesion in the lungs. So not all patients present, they don't come to the doctor saying, I have risk factors for lung cancer, can you check? That's changed a little bit. We do have screening programs for people who are at higher risk for lung cancer, such as smokers, and after a certain age, we do have screening programs in place. But often a case will not necessarily have any particular sign or symptom. So let's say the patient has a spot, then what will happen is a referral would be made to what's called a diagnostic assessment unit for cancer, for lung cancer. So we have that in St. Joe's, where it's very, very targeted for people who have a questionable lesion in their lung. And so they will go through CT scan, sort of a routine workup with imaging, and review with the clinician regarding their risk factors. And then usually at that point, a biopsy or some kind of sampling is arranged to look for evidence, direct evidence from the tissue that there is in fact a lung cancer, or is it another lesion which is mimicking a lung cancer? Sometimes that can happen as well, like an infection sometimes can look very concerning and mimic a lung cancer. So after they've been to this specialized clinic, usually they will see a radiologist or a surgeon who will perform the biopsy or the sample of the tissue. And again, that can be done through different techniques. Often people here get what's called a core biopsy, and that's simply done through the chest wall. And it's done under the assistance of a CT scanner. And they basically look on the CT scan where the lesion is, and they put a core through that area and take out a core of tissue. And then that's where our role comes in. Well, I think in general, the main improvement in lung cancer survival will be early identification, screening, and prevention. That will be number one. So no smoking, getting rid of other risk factors. There are other risk factors for lung cancer other than smoking. So that's number one, is prevention. And number two is that if you are dealing with an unfortunate case where it's advanced, that you will have more targeted therapies. And that perhaps if the disease is well controlled, it becomes more like a chronic disease where you simply monitor how it's doing and you modify the treatment accordingly, but you keep it under control, like a chronic illness. That's probably how I would envision. The barrier I see to that is that type of approach is probably very expensive. For example, some of the newer drugs for lung cancer are roughly $9,000–$10,000 a month. So I'm not sure, how that type of cost can be covered, either on a personal or on a healthcare level. I don't know how that would be possible. That does seem to be an issue, is that there's like a popularity contest. It's like, if it's breast, it gets a lot of attention. There are a lot of diseases that seem to, they don't get money, they don't get the attention. Why, I don't know. And for lung cancer, it's, this whole thing that you brought it on yourself. And, that's that's a very negative attitude. But, I think you could say that for many other conditions that we have too.
Right.
But there are other causes of lung cancer, we're seeing more and more people who are non-smokers with lung cancer. So there's things like radon gas. I don't know if you've read about that. That's very interesting. And, other types of exposures that cause people to develop tumors actually at quite a young age too. Some of them are in their 30s. We've had some lung cancer patients in their 30s and 40s.